As we talked to the patients in our system, we went out into the waiting rooms and we said, tell us about your health issues. Tell us about what matters to you. What are the barriers that you face on a daily basis? Over 50% said to us, food is a challenge for us. Housing is a challenge for us. Employment is a challenge for us. So we began working with health leads. These health leads can provide support to our patients and to our providers to really address the most basic needs for the patients.
I have a patient with severe diabetes who kept coming into the office, and we couldn't get her diabetes under control. I kept increasing her insulin dosing, and it still wasn't happening until I realized that she didn't have a refrigerator, and you need to refrigerate your insulin in order to keep its effectiveness. And until she could get that basic need met, she was not going to be able to use her insulin effectively. So the real thing she needed wasn't an office visit with a doctor prescribing her insulin and looking at her blood sugar log. What she really needed is something that happened outside the clinic.
I may think that a patient's asking for glasses and I just send them off to see the eye doctor and things are done. But there's a lot of steps for patients to follow. They gotta see the eye doctor, get the referral, get transportation, be able to afford the glasses. There's a lot of holes that a patient can fall through the cracks. And we had a patient who was linked with an advocate to a place to get free glasses and was actually able to navigate all those steps and end up with a pair of glasses. We had another patient that had their electricity cut off because of their PG&E bill running out, and so they lost their light. This affects their ability to store medication safely, like insulin in the refrigerator, be able to plug in important machines. And through the Health Leads program, a patient was able to get the right forms, get a note from their doctor, and get their power reinstated much quicker than they would have otherwise. These are little things we don't think about, but they make a big difference in our patients' lives.
Health Leads is a program I have wanted since before I ever started here. And I say that because I know I have done my best to try to ask people things like, will you be able to afford your medicines? Do you have enough food? Do you have the right kinds of foods? What help do you need? And whenever I could work in the time or energy, I've tried to send them in those areas.
When our patients come in here, they're very, very sick, a lot of them, and if they can have their basic needs met as far as food, knowing where they're going to sleep, knowing that money is going to be coming in because their paperwork's filled out, Social Security or Medi-Cal or medical forms, whatever needs to happen. If the basic needs are met, then we're able to work on then the hypertension, the stress. How can we help their illnesses if even just their basic needs are not met? Some people come here very hopeless, not knowing what to do and who will care for them or take care of them. So they feel like someone is actually loving them and helping them.
When a patient registers for an appointment, they're given a screening form to fill out. They identify if they have any needs on that screening form. Their provider then looks over the screening form to see if it's a positive or negative health lead screen, and then the provider then if it's positive, the provider then refers the client to the health leads desk.
We as health leads advocates believe that our patients can't be healthy if they're worrying about feeding their families or if they're worrying about the mold that's growing in their homes. And so what we try to do as advocates is connect patients to community resources that can help them with that.
Estuve enferma por 2 meses porque el nivel de azúcar era muy alto debido al estrés que estaba pasando porque no sabía cómo iba a ser para obtener los biles o los pagos de los biles. Me ayudaron bastante porque me conectaron con diferentes programas que ellos pudieron ayudarme. Mi salud ha mejorado y debido a la ayuda y el apoyo que he obtenido de ellos y los programas que ellos me han como hecho la conexión.
The partnership between Contra, Costa Health and Health Leads is a complementary because our missions are so aligned. We have a deep expertise in working with the underserved, and they have a deep expertise in working on social determinants of health. So it's because this group has learned how to co-locate or cohabitate or integrate, if you will, with delivery systems, that it makes a perfect match for us. So it's been a very strong partnership from the beginning. Our missions are quite aligned, And so we really hope to be working with health leads long into the future.